We're at Iredell Health System, which is a 247-bed independent hospital in Statesville, North Carolina. What does that mean to everyone else? Everybody has their unique scenario, and our unique scenario is we're one of 9 independent hospitals left. We actually have 247 hospital beds here. We have about 20 physician practices. We have 250 patients a day in our home health agency. We own 3 ambulatory surgery centers, and we have a 48-bed skilled nursing facility. So we try to do the whole spectrum of care, but really one of the things we have not done at all was research. And interestingly, Cerner and the Learning Health Network reached out to us and said, would you be interested in doing some research with Delegato? And our first thought, I met with our Vice President of Medical Affairs, and honestly, our first thought was no. We don't have a lot of spare time. Looking at research is really just another aspect of care that adds a lot of time. I came from a large academic medical center. When I was at that academic medical center, we really kind of had 2 different divisions of the company. We had the clinical side and we had the research side. And understandably, it was like two warring siblings at times. If you were on the clinical side, you felt the research side got everything. And if you were on the research side, you felt like the clinical side got everything. But as a whole, each side was really busy. And we only have one group of people. So we were very skeptical, that we would have the time to do it. But then we had to step back. We had to step back and say, wait a second, let's look at it from a community perspective. Let's not be selfish. Let's say, would it be beneficial patient care-wise? And realistically, it is. If I have the opportunity to be in a clinical trial, if I have a unique situation or my family member has a unique situation going on, and I can help the care that I receive, why wouldn't I want it? If I can help the care someone else might receive at a later time, again, why wouldn't I want? A lot of times from Statesville, from where I'm at, you'd have to travel for clinical trials. Now, thankfully, living in North Carolina, there's a lot of wonderful universities, a lot of wonderful university-based clinical trials going on. But that's still a 60 to 90 to 120-minute drive every time. So from a patient care standpoint, it made a lot of sense. Keeping folks in the community makes a lot of sense. So that took us back to, well, we can't afford it, maybe. Financially, every hospital is struggling. 60+% of hospitals in 2022 lost money on operation. Last thing you can do is add other aspects of care that are going to lose money on operation. So we had to say, can we do it from that perspective? In this case, we're going to get paid to do it. We're going to get assistance to do it. So that takes away the financial ramifications, the financial concern. When we went back and we looked at all those, we said, this really does make sense. Here I have to stop a second because honestly, as an independent hospital, we're stubborn. And we always say, well, if somebody else can do it, why can't we do it better? And so the first thing we said was, well, let's do it on our own. And realistically, if we were to doing it on our own, we would have to build a research department. Our research department would be probably a department of, one. That's what we probably could afford. And that person would have to be the jack of all trades. They would have to understand everything about that research project, how to get in, how to get out, how to sign up, how to keep people moving forward in it. And that would be a tall task for any person. And you'd have to find that perfect person. So that wasn't a great option. And so then we thought about, is there another way that we can do it? And realistically, there really wasn't. So then we went back to the charter of our organization. And the charter of our organization is truly to take care of the health and wellness of our community. Well, what better way to do that than to get involved with the opportunity for research? So we said yes. And we just started up this past fall, working with Delegato, working with the Freenome study. We've been pleased with our results. We've gotten a research coordinator here on site, sometimes remote, which is perfect. We found space for the person, but that was all we had to do. And they cull the chart. They assist in making sure we are looking for the best way to get the right folks involved in the care. Secondly, what we saw is we started to get some checks for that. Financially, you're not financially motivated with choosing research, but you can't lose in that context. We can't sit there and say, here's another drain to our limited resources. So that's been a success. And most importantly, it really has been a win for the community. And if we're going to be community-based care, the biggest thing we're worried about is making sure that our community continues to get healthier and well, then there is no reason we wouldn't want to participate. We've been really happy with our first choice. Recognizably, we're still young in the game. It's going to have to see how does it balance out when we get to 4 studies or 5 studies or, 16 studies. But right now, it's been a great start. I have no reason to believe it's going to be anything but that moving forward. And we look forward to it occurring over the next several years.